Hello, my name is Angela Checki, and this is a presentation on seasonal affective disorder. So, seasonal affective disorder, or SAD, is a type of depression that's related to changes in the seasons, and it begins and ends about the same time every year. Most common signs and symptoms of SAD are feeling listless, sad or down most of the day, and you're feeling this nearly every day. You're losing interest in activities that you once enjoyed, having low energy and feeling sluggish, having problems with sleeping too much, experiencing carbohydrate cravings, overeating and weight gain, having difficulty concentrating, feeling hopeless, worthless, or guilty, and having thoughts of not wanting to live. And from hearing these and seeing these symptoms, one would think like, oh, this sounds just like regular depression, which it can be. It can be just regular depression, but with SAD, it is more so correlated with the change of the seasons, not so much what the factors that go into regular depression or major depression. Okay, so different seasonal symptoms. So in most cases, seasonal affective disorder symptoms appear during late fall or early winter and go away during the sunnier days of spring and summer. Less commonly, people with the opposite pattern have symptoms that begin in spring or summer. In either case, symptoms may start out mild, but they can become more severe as the season progresses. So right here on the left side is fall and winter seasonal symptoms. So during that time, you're gonna experience appetite changes. You're gonna potentially crave for more foods that are high in carbohydrates. That's like breads and pastas, weight gain, oversleeping, tiredness, or having low energy. This these symptoms align more with the symptoms that I had mentioned in the previous slide, and these are more common. It's more common to have a winter onset SAD than a spring and summer one. So right here for the spring and summer symptoms, they are literally almost the exact opposite of the fall and winter symptoms. So instead of oversleeping, or having a hard time going to sleep, you may suffer from insomnia. Instead of overeating, you may have like a poor appetite, barely eating anything throughout the day, which can lead to weight loss. And you also have feelings of agitation or anxiety or increased irritability. Okay, so the specific cause of seasonal affective disorder remains to be unknown, but there are some factors that may come into play, and they include circadian rhythm, melatonin levels, and serotonin levels. So, circadian rhythm, it's the decrease in the sunlight that may disrupt your body's internal clock and lead to feelings of depression. It's getting darker much earlier now, and that can lead people's circadian rhythm to be off and just disrupt your body's internal clock. And it just, it'll trigger the feelings of the depression symptoms for SAD. Also, serotonin levels. Reduced sunlight can cause a drop, I'm sorry, in serotonin that may trigger depression. Serotonin is a brain chemical that affects the mood. So if there's a severe drop in that, then that will trigger depression in some cases. And then melatonin levels, the change in season can disrupt the balance of the body's level of melatonin, which plays a role in sleep patterns and moods. Okay, so SAD is more commonly diagnosed more often in women than men. And, different factors could play a role into that. More women actually may be willing to talk to somebody and get some help, which would lead to having more statistics showing that they've been diagnosed more. And SAD also occurs more frequently in younger adults than in older adults. Um, Risk factors are starting with family history. So people with SAD, they may be more likely to have blood relatives with SAD or another form of depression. Also, having major depression or bipolar disorder, these the symptoms of depression may worsen seasonally if you do have one of these conditions. So people who have actually bipolar disorder, they are at an increased risk of seasonal affective disorder. Some people with bipolar disorder, they have episodes of mania that can actually be linked to a specific season. For example, spring and summer can bring on symptoms of mania or a less intense form of the mania. It can bring on anxiety, agitation, and irritability. It also, these people may also experience depression during the fall and winter months as well. Another risk factor is living far from the equator. SAD appears to be more common among people who live far north or south of the equator. This may be due to decreased sunlight during the winter and longer days during the summer months. If I'm not mistaken, the farther you are north, it's definitely going to be a decrease in sunlight. So places like Alaska, Canada, um, but further down south, maybe more sunlight, which causes more of like the spring and summer onset of SAD. And then a major risk factor as well is low level in vitamin D. That's very important. So some vitamin D is produced in the skin when it's exposed to sunlight. Vitamin D can help to boost serotonin activity. Less sunlight and not getting enough vitamin D from foods and other sources may result in low levels of vitamin D in the body. And they have, of course, you have vitamin D supplements that you can get from the store over the counter, and your doctor can also prescribe a higher dose, I believe, of vitamin D, especially if you've taken tests and it's shown that, oh, you have pretty low levels of vitamin D. Some medical doctors will actually just prescribe it to you because sometimes the over the counter or whatever you find in the store may not be dosed high enough. And this is just a short clip talking about SAD.
It is time for Patel It Like It Is, where Dr. Alok Patel shares health advice on the topics that matter most to you. Today, we're talking about seasonal affective disorder and what to do if you're experiencing seasonal depression. Here's Dr. Patel with more.
The days are getting darker, and this means less bright, shiny daylight, potentially some mood changes affecting millions of us. So let's shed a light on seasonal affective disorder. Seasonal affective disorder is a type of depression that is characterized by its seasonal pattern. When seasons change, so does light, and this can affect energy levels and mood. A diagnosis of seasonal affective disorder can usually be made off of understanding somebody's symptoms, which may be similar to symptoms of depression, such as feeling helpless, having trouble concentrating, or no longer enjoying hobbies that somebody used to. And with winter seasonal affective disorder specifically, some people may also experience overeating, oversleeping, and social withdrawal. An exact treatment plan may differ based on the individual, but it usually involves some form of light therapy, talk therapy, or medications, or a combination of all of these. And some people, including several of my colleagues, swear by light therapy, essentially getting bright exposure from a light box for about 30 to 45 minutes per day. This is really bright. Women are more likely to be affected, as are people who have other mental health illnesses. It's also more common farther north, where it's darker. So this fall or winter, if you're feeling down or depressed, it could be seasonal affective disorder. It could also be related to dozens of other factors because mental health is a broad issue, but you want to make sure you check in with the healthcare professional and you ask for help.
And Dr. Alok Patel joins me now for more on this. Dr. Patel, you just said there could be a ton of other factors here. So how can you tell? What are the indications that it is a seasonal issue and not something else?
It's exactly that, the fact that it happens with the seasons. So people who have coexisting mental illnesses, whether it is depression, anxiety, even alcohol abuse, eating disorders may have these symptoms overlap. But this is a type of depression that just has this temporal pattern where it comes and goes with the season. So that's kind of an important thing for people to check in with themselves about. We also have to pay attention to the fact that this is winter. There's also the potential for people to feel stressed out, burned out, or even lonely. So a lot of different variables to play with.
What if you're just grumpy because it's cold out? Does that count?
It totally does, because I'm kind of grumpy when it's cold out. I also, listen, hot take, I'm not a fan of the days getting darker a little bit earlier. And so all this plays into my moods this season.
So how does light therapy work for seasonal affective disorder? How do you get started if you want to do it?
Well, the first thing I will say is it is important to check in with a healthcare professional, because we just talked about all these other conditions somebody may have. Now, when it comes to seasonal affective disorder, there's still some research about the root cause, with some scientists believing that it may be because of changes of melatonin and serotonin hormones that are affected by how much light we see in the day. So a light box is supposed to emulate the sunlight. There is a measure that people should look for if they want one, about 10,000 lux, which is like a sunshiny morning. You throw that box in front of you, don't look directly at it for about 30 to 45 minutes. Make sure if you get one, it is a approved responsible one that has a UV filter on it. You can check with the healthcare professional, and people swear by it. Research actually supports this as well. Some people may need to use a light box in addition to therapy, medications, but whatever you do for yourself that works, I'm all for it.
So how does the clock change and winter play a role in all of this?
I mean, I watched your video on social. I know that you were in tune with this topic, and it differs per person, but I think it's important for people out there to not necessarily conflate the two. Seasonal affective disorder, we're talking about less daylight, but the clock change doesn't necessarily affect how much light there is in the day. It just shifts the time back earlier. And you know what people, especially some sleep scientists, do feel like is standard time, what we're in right now, is more aligned with our biological clocks. People actually will sleep better right now versus daylight savings time in spring, when you actually lose an hour of sleep. So it's kind of a time where people need to pay attention to their own schedules, potentially pay attention to their sleep hygiene. And people like me, like, I don't like it getting darker earlier. I like that late light.
Okay, so we need to live in summer all year long is what we're learning about Dr. Patel.
It's not bad.
Any other advice for people who are struggling with this?
I think it's really important to be honest about it. If people are struggling with seasonal affective disorder, there are tools available. We just mentioned light therapy, but it's also important that we are continuing this conversation about everyone's mental health, and we're checking in with one another. And people use all these tools that are available, like talk therapy. It is such a valuable, understated thing for people, a resource for people out there just to check in with themselves.
Also, I have a life hack for you.
Hit me.
Therapy light in the bathroom. You just turn it on while you're getting ready. No extra time or effort needed. You're getting that bright light. Half an hour while you're getting ready.
Where did you get yours from?
We'll talk about that later. Dr. Patel, thank you. And remember, Dr. Patel is here to take your questions. Leave a message on our Instagram feed at ABC News Live, and he might answer your question right here on Friday.
Hi, everyone. George Stephanopoulos.
Okay, so this just further continues just different treatment methods and such. So again, at the top, exposure to sunlight. So spending time outside or near a window can help relieve symptoms. So far throughout this, we've talked about, and I've mentioned the sunlight. That's why they were talking about the light therapy or going outside. It's really, really important. Without the sunlight, you're not getting that vitamin D, which can cause low levels of vitamin D, low levels in serotonin. Sunlight is just very, very important. And then next, light therapy. So if increasing natural sunlight is not possible, exposure to a special light for a specific amount of time each day may help. So I don't think in that last video I didn't mention which kind of lights to use, but I do believe further down we will mention a couple of different options and brands for the lamp. And then also psychotherapy, cognitive behavioral or interpersonal therapy helps change the distorted views you may have of yourself and the environment around you. And it can also help you improve interpersonal relationship skills and identifying things that cause you stress, as well as how to manage them. It doesn't hurt to be able to identify the things that cause stress. I know we talked about, going outside and eating different foods, but it's also important to know what exactly other factors play a role and how I can get ahead of them. And then lastly, antidepressants. So these are prescription medicines that can help correct the chemical imbalance that may lead to SAD. So of course, if you're ever considering taking any medication, I would consult with your medical doctor or a psychiatrist if you have one. And then here's a video on light therapy.
Fall is here again, which means pumpkin spice lattes and apple picking, and unfortunately, seasonal affective disorder. If you happen to suffer from SAD, you've probably heard the suggestion to get one of these SAD lamps. But do they work? Hi, Jamie.
Hi, Dory. Good to meet you. I'm an associate professor at Stanford University and a staff scientist at the VA hospital. And I've been studying the impact of light on human brain and behavior for about 20 years.
Do people call it SAD or just SAD?
Both.
Both. Okay. It feels really silly to be like, have you experienced SAD?
I experience happy. I experience sad, yes.
Yeah, I experience all of it all the time and it's overwhelming. Can you tell us what exactly is seasonal affective disorder, or SAD?
Seasonal affective disorder, as opposed to standard depression, is linked to obviously the seasons. And so this is something that you would expect to see more often in individuals who are living in the northern climes, where you're going to have longer nights in the wintertime. So in the summertime, people are fine. In the wintertime, they become more depressed. We think that the circadian system is involved. The circadian system helps keep track of things like night length. It's not like there's only one cause for this. Some of it's going to be an inability to get outside. Some people can definitely be more depressed when that happens. And some of it's going to be directly biological, just that you're getting less light during the daytime.
Is it something you've also dealt with personally? Have you ever experienced SAD?
I have not. Lots of other issues, but not SAD.
Yeah, same. I do have one, and like super bright. But what is it about the brightness that makes you experience less SAD?
One of the theories is that you're basically shortening your brain's perception of the night length. So if we were living without electricity, you would have a perception of night length based on when the sun rose and when the sun went down. The idea here is that you're basically pushing back to an earlier time when the sun is coming up. And so to the brain, it feels like those nights are getting shorter. So if you're getting up at, say, 7 a.m. and it's still dark out, but you turn this lamp on and you get a big dose of light, then that's when the brain's going to think that the night has ended.
Do SAD lamps actually work? What is the research on that indicating at this point?
The lamps can definitely work. One of the biggest problems with the lamps is compliance. Do you use them? Frankly, going outside is better if you can do it. If you're in Wisconsin and it's January, this might not be so easy to do.
Some of them are, huge. And it's not a giant apartment, and so it involves me like moving it back and forth. And depression is an Ouroboros. Like the more depressed you are, the less likely you are to do the thing that will help you be less depressed. So it's just like, before somebody decides to buy a SAD lamp, what should they consider? Are there certain qualities that they should be looking for in a SAD lamp?
So I think the first thing you need to do is make sure that what you have is SAD. You really want to go see a doctor, make sure this is what you have, and have them, give a formal recommendation for what you should be doing. These things can work. It's just a question of convenience and comfort. Do people like it? Will people use it? And that's really the biggest issue with these devices, especially on a daily basis and for long enough. Typically people say, well, it's 30 minutes, but will you do that every day? Or do you start to kind of cheat? You turn the light on, you sit there, but then you don't look at it because it's bright and annoying.
It's bright.
You're really looking for something that is going to fit in with your lifestyle, your decor, your demeanor.
This lamp is our top pick, the Carix Daylight Classic Plus. Unfortunately, when it shipped, it showed up with a little bit of damage, and that's just showbiz, baby. Luckily, we also have this model by Carix, which basically functions the same way, and we'll be using it for the sake of this video. It's important to know that obviously we can't test these SAD lamps for how effective they are at actually combating seasonal affective disorder. So when we tested these, we were mostly assessing durability, comparing prices, and making sure that they lived up to specs. Both of them have a really easy on and off switch. Both of them hinge super easily from the base, and both of them were super durable. Usually. This really is a fluke. It's a great model, besides the day that you need it for a video.
Could you just talk about how somebody would use a SAD lamp?
Typical recommendations are going to be to get a half hour of the light.
Yeah.
So it's a question of how can you position the light so that it doesn't have a lot of glare, so that it doesn't have this kind of annoying aspect to it. And so if you can have a window behind it, even if it's still kind of dark outside, it's going to be brighter usually than what's inside the room. Usually people have it about 3 feet away. Again, it doesn't have to be straight on into the eyes. It can be at an angle, but it needs to be bright.
Jamie, do you have any other suggestions for people suffering from SAD?
One of these lamps is low-hanging fruit. This is not taking a drug. It's not going to have a lot of side effects. It's not a big investment. And if it gets rid of depression for multiple months of the year, that's fantastic.
If you were super wealthy, you could spend like your summers in Denmark and then your winters somewhere like warm, like Los Angeles, for example.
If you're that wealthy, you could pay someone else to have your SAD.
That's so true. Hi, I hope you had a happy experience watching this video about SAD lamps. If you like what you saw, feel free to like, comment, and subscribe. Thanks.
Okay, so here are some more quick tips to combat SAD. Again, right here at the beginning, spend more time outdoors, getting that daily dose of vitamin D, which means sunlight. Keeping a journal to document and manage any negative thoughts and feelings, which is very helpful and I believe at times very, underrated. We have all these negative thoughts sometimes in our head, and it's just helpful just to get it out on some paper to alleviate those type of thoughts and feelings. And if possible, maybe rearranging office or house furniture to maximize the sun exposure, maybe repositioning your desk where you're facing towards the window or in the house, rearranging some things where you naturally may be able to get more of the sunlight that comes in the house. Um, Next is resisting unhealthy eating, which may be difficult, excuse me, for most of us, myself included. It's very hard to, not eat the foods that we really like or the foods that are convenient. But it's really important, especially if you struggle with SAD. Just getting more like green vegetables and just more light things and not things that are so heavy in carbohydrates would be very beneficial. And like it was mentioned in the video, taking a vacation in the sun. Of course, we're not all able just to get up and afford a sunny vacation in possibly Florida or Jamaica or somewhere, but that is a good tip. Again, taking vitamin D supplements. Your doctor can prescribe it to you, or you can go into the store and get some supplements as well, some vitamins. um, Eating vitamin D foods like salmon and eggs and fortified yogurts, and then trying to work a little bit more outdoors. I know that may be kind of difficult to do during the winter time. It just depends on your tolerance for the cold. Me personally, I don't really like the cold, so when it's the warmer times, I do try to make a point to, um, take my laptop and go out into the balcony, or I might feel like going to Starbucks and I'll sit outside and do my work. So for some of us who still work at home some days, or not even have to work, if you just want to scroll on your phone or, do other personal things on your computer, like it doesn't hurt to, go outside and do it just to get some more light. And these are just more strategies about SAD.
All right, December 21st is the winter solstice and the official beginning of winter. It's also the day with the fewest hours of sunshine or daylight. Winter's shorter days can trigger a form of depression called SAD, or seasonal affective disorder. For some people, it's more than just the winter blues. Trust me on this. But you don't have to tough it out. Dr. Adriana Fan joins us now with some strategies to cope with SAD. She is a director of psychiatry consultation at Hackensack University Medical Center. Dr. Fan, good morning to you. How are you?
Good morning. Thank you for having me.
Okay, so what causes seasonal affective disorder, and just how serious is this condition?
So it is a type of depression. So depression can affect your life in many ways, right? It affects the way you think, you feel, it affects your functioning. So this type of depression comes about the late winter, late fall, early winter, when, as you mentioned, the sunlight is less and less. During the winter days. So this type of depression comes with very low mood, kind of a sense of lethargy and fatigue. People feel like almost like hibernating. They tend to overeat, oversleep. So the exact cause is not well understood, but we believe that the lack of sunlight decreases the amount of a neurotransmitter called serotonin. So serotonin is a neurotransmitter, is implicated in mood, in sleep, and in appetite. There's other causes, for example, melatonin, overproduction of melatonin. So we've been hearing about melatonin, and we know that it promotes sleep. So maybe that's a reason why people feel that sense of lethargy. Now, this less sunlight can affect the circadian rhythm. So our body clocks are kind of disrupted by this low sunlight in general during the day.
So some of the symptoms, and just touching upon some of the things that you just mentioned now, I'm going to list them for the folks at home. Low energy, craving carbohydrates and overeating, and disordered sleep patterns. Are there any other signs that indicate this is more than just the winter blues? I know you talked about a few, but I just, again, want people to be able to see this.
That's right. So the severity of the depression, right? So when we call the winter blues, it's just that sense of lethargy, isolation, feeling like you don't want to be outside too much, you don't want to socialize with people. When it becomes so severe that basically affects the way that you are functioning, that's when we're really have to think about other types of treatment. If it really is affecting your daily life, you have to think about treatment.
Is there a group of people that you think are more at risk than others to be affected by SAD?
Sure. So it matters where you live, right? So you mentioned the far and northern states like New England, Alaska, with in general less sunlight during the year, are going to be more at risk of developing seasonal affective disorder than people who live, for example, in the southern states like Florida. We also consider at risk of people who already suffer from seasonal affective disorder, or people who suffer from general depression, or even bipolar disorder 1 and 2. We know that this disorder can run in families, and we also know that other disorders can be comorbid, as we call it. So, for example, anxiety disorders, eating disorders, ADHD can also be prevalent in these patients who have this tendency of suffering from SAD.
I want to get to some of the strategies that you recommend to help people deal with SAD. The first one is get more light, either naturally or use a light box.
That's right. So we talk about these, people already know about the light boxes, so the light therapy boxes. So basically the purpose of these boxes is to provide or to imitate the natural sunlight that we will get during a regular day. So those light boxes provide a white fluorescent light that has to be on certain lux. So it has to be around 10,000 lux in order to be beneficial for you. So, but if you don't have that light, which we also have to consult with your physician before using it, get as much natural sunlight as much as you can.
Just get that face. Just get that face outside. Take that walk.
That's
just get outside. I got to be quick with these other two, but I want to get to them. Eat more foods with vitamin D. What are some examples?
That's right. So, for example, salmon, eggs, green vegetables, mushrooms, all these things that produce vitamin D, because it's going to be low in the winter months.
And also you say, finally, stay in touch, resist that urge to isolate. I know you kept talking about isolation before that can really, really bring on these symptoms, but why is this so important?
So always socializing is very important. That sense of hibernation is not going to be good for you. So try to continue to get in touch with friends, to do things outside, even if it's, during the dark hours. Resist that temptation of being inside and isolate yourself. Please just stay in touch with friends and family during these months.
And don't look at the calendar because spring can look like it's so far off. Doctor, thank you very much for taking a few moments. Happy holidays, and thank you for joining us.
Thank you so much.
All right, Dr. Fan, thank you very much. One bit of good news is now from every day, it gets a little bit longer, a little bit brighter until spring is on that horizon. So just hang in there, but do take some of those tips to heart.
Okay, so just like the end of the video just said, one thing that really stood out to me is resisting the urge to isolate. That is very, very important. Um, if you're ever feeling like you just want to be by yourself and you just don't have the motivation, spending time with friends and communicating with family can help a lot. I know it probably, for people who struggle with this, it may be easier just to sit in the house, whether it's dark, whether it's light. You just want to sit in the house and you may not want to be bothered. You want to come home straight from work. You may not want to be bothered. Please resist the urge to even do that. Your friends invite you somewhere, force yourself to go. Family's calling you, pick up the phone. It can be very beneficial. So, and just take signs and symptoms of seasonal affective disorder very seriously. As with other types of depression, SAD can get worse and lead to problems if not treated. These type of complications can lead to, social withdrawal, having problems with school or work, um, substance abuse, if you're having these feelings of anxiety or you're having a low mood, some people turn to alcohol or other substances, drugs to help alleviate how they're feeling. And, you don't want that. It's not really helping you in the long run. And other mental health disorders, such as anxiety or eating disorders, that can be a complication of not treating SAD properly, and also suicidal thoughts or behavior. Okay, and preventions. So, there actually really is, there's no known way to really prevent the development of seasonal affective disorder, excuse me. But however, if you take steps early on to manage the symptoms, you may be able to prevent them from getting worse over time. So you may be able to head off any serious changes in your mood, appetite, energy levels, and you could predict the time of the year usually of when these symptoms may start, especially if you already know that you have SAD. Usually okay, usually around the mid month of September, I start to feel this way. Um, and treatment can help prevent complications, especially if SAD is diagnosed and treated before the symptoms get really bad. And some people find it helpful to begin treatment before the symptoms even normally start. And so during fall and winter, sometimes they'll start getting their treatment during the summer, even before that, and then continue treatment past the time symptoms would normally go away. Other people need continuous treatment to prevent symptoms from returning at all. So it's really up to you. I think it's better to be proactive about something, especially when it comes to symptoms related to any type of depression. Because the more depressed we may feel, it becomes much more difficult to actually do the things that we need to do so our depression does not get worse. And also, of course, I thought it was important to add, for anyone who experiences SAD or other forms of depression, or even other mental health issues and substance use, you can always call or text 988. It's known as the Suicide and Crisis Lifeline. Somebody will be able to talk to you. Of course, if you don't want to speak to somebody, they can text if that works better for you. And in some cases, a counselor would even come to your home out in the community if, you require that level of attention. And thank you so much for watching.